back to KinetiCare by Dr. Abeer Ali. In today's Lecture 7, we will study the anterior compartment of the forearm, which includes the flexor and pronator muscles, a very high-yield topic for exams and clinical practice. Let's begin. Introduction. The anterior compartment of the forearm contains muscles responsible for flexion of the wrist and fingers, pronation of the forearm. These muscles are arranged into 3 layers: superficial layer, intermediate layer, deep layer. Right finger important points: common nerve supply, median nerve. Exception: 1.5 muscles supplied by ulnar nerve. Common origin: medial epicondyle of humerus, common flexor tendon. I superficial layer, 5 muscles. 1. Pronator teres. Origin: humeral head right pointing arrow medial epicondyle. Ulnar head right pointing arrow coronoid process. Insertion: lateral surface of radius. Nerve supply: median nerve. Actions: pronation of forearm, weak elbow flexion. 2. Flexor carpi radialis, FCR. Origin: medial epicondyle. Insertion: base of 2nd and 3rd metacarpals. Nerve supply: median nerve. Actions: flexes wrist, abducts hand, radial deviation. 3. Palmaris longus. Origin: medial epicondyle. Insertion: palmaroponerosis. Nerve supply: median nerve. Actions: weak wrist flexor. Tenses palmar fascia. Clinical note: this muscle is absent in about 15% of people. 4. Flexor carpi ulnaris, FCU. Origin: humeral head right pointing arrow medial epicondyle. Ulnar head right pointing arrow ulcranon and posterior ulna. Insertion: piezoform, hook of hamate, base of 5th metacarpal. Nerve supply: ulnar nerve, exception muscle. Actions: flexes wrist, adducts hand, ulnar deviation. 5. Flexor digitorum superficialis, FDS, intermediate layer. Origin: humero-ulnar head right pointing arrow medial epicondyle plus coronoid process. Radial head right pointing arrow upper half of radius. Insertion: middle phalanges of digits 2 to 5. Nerve supply: median nerve. Actions: flexes pip joints, flexes MCP joints, assists wrist flexion. Deep layer, 3 muscles. 1. Flexor digitorum profundus, FDP. Origin: upper 3/4 of ulna. Interosseous membrane. Insertion: distal phalanges of digits 2 to 5. Nerve supply: lateral half, 2 to 3 digits, right pointing arrow median nerve. Medial half, 4 to 5 digits, right pointing arrow ulnar nerve. Actions: flexes dip joints, assists flexion of PIP, MCP, and wrist. 2. Flexor pollicis longus, FPL. Origin: anterior radius. Interosseous membrane. Insertion: distal phalanx of thumb. Nerve supply: median nerve, anterior interosseous. Action: flexes thumb. 3. Pronator quadratus. Origin: distal ulna. Insertion: distal radius. Nerve supply: median nerve, anterior interosseous. Actions: primary pronator of forearm. Stabilizes distal radio-ulnar joint. Applied anatomy, clinical importance, carpal tunnel syndrome. Compression of median nerve, loss of thumb opposition, sensory loss in lateral 3.5 fingers. Golfer's elbow, medial epicondylitis, due to overuse of common flexor tendon. Pain at medial epicondyle, ulnar nerve injury, weak FCU and medial FDP, leads to claw hand deformity. So in today's lecture, we covered layers of anterior forearm muscles, superficial, intermediate, and deep muscles, nerve supply and actions, important clinical correlations. If this lecture helped you, like the video. Subscribe to KinetiCare by Dr. Abeer Ali. Press the bell icon for upcoming lectures. See you in the next lecture.